everybody, it's time for us to go ahead and tune in here with our very own Emma Burns, who gives us the latest on what she's talking about today, including some net health updates for us on the virus, actually, that's still going around.
Yeah, so I'll kind of touch on cyclospora and how it's affecting East Texans. Also, how Net Health, which is the Northeast Texas Public Health District, how they track these illnesses and diseases across East Texas. So they have anywhere between about 86 to 100 different diseases they track 24/7, 365 days a year. And if it's a leap year, they even count that day as well. But anyways, they track these diseases all year round. So basically, let's say you have think back to COVID.
Yeah.
During the COVID period, when there was somebody who was infected, they had that case of COVID. That was then they got the test done.
Right.
Then the test information was sent off to a lab. The lab sent it off somewhere else, and then it was sent back to the local health authority. That's what Net Health serves as. So let's say you go to a standalone ER and urgent care. You get swabbed for the cold or flu sometime, especially now that school's about to get back into session. Those test results will go off to the lab, and the lab will send them to Net Health. They're epidemiologists, or they're folks there that study patterns and different illnesses and diseases, are going to try to see if there's any ties to where, let's say, going back to the COVID example, did somebody get COVID from their house? Did somebody get COVID from a friend? Or cyclospora, did they get it from a certain restaurant? Because I think as of this week, there are 5 cases of cyclospora in East Texas right now, and none of them that they have discovered are connected. That's been done through their epidemiologists. So if that didn't make sense, you're kind of a little lost. It's kind of a crazy little circle of life here on how they figure it out. I was able to speak with the spokesperson for Net Health, Terrence Ates, to kind of break down what they do to kind of learn more about diseases in East Texas and prevent them as well.
Take a listen.
When our epidemiologists receive notice of a positive case, they begin the contact tracing process so that they can learn as best they can what the source may have been or where it may have come from. So we have 5 cases of cyclospora in our 7 counties here in East Texas, and each of those 5 individual persons have no relation, no association with each other. They didn't buy any produce from the same place. They didn't eat at the same restaurant. Though that type of info is what our epidemiologists learn after they get in touch with a person to try to identify what the actual source of the infection was. Then our epidemiologists also confer with doctors, nurses at that testing location to see if they've had any other patients who have had similar symptoms to what that positive case may have had. So it's a lot of investigative work, it's a lot of detective work of trying to make sure that we do not have any local outbreaks, similar to how cyclospora has had outbreaks in other states in the U.S.
All right, everybody, and that's just more of an update on the health side, but who you spoke to today really just talked about either contact tracing or how it can be spread, right?
Yes, so those are the things that we talked about. So we know that they are collecting this data from knowing that there are 5 cases, again using that cyclospora example in East Texas. Their route was to see if there was any connections between any of them. Like I said, they were not. They were just random. And something interesting he told me about that cyclospora specifically this morning, just in conversation, was that it's kind of like a summertime thing. So it's not uncommon to see cyclospora because you're going to eat more fruits and vegetables, especially in the summertime.
Right.
And that parasite, kind of like salmonella, can get on that food if you're not washing it. So that was basically what our cyclospora conversation was. But going back to what they do, they are really, really pushing that for people to be educated on what causes these diseases and illnesses. And if you think you're sick, go to the doctor. It's better to have that negative test result and have peace of mind than to get a positive test result after just being sick and nasty and possibly spreading any other illness to anybody else going to work or at school.
Well, I mean, you don't want to spread it to anybody else, and just make sure you're taking care of